For more than a month now, the number of new COVID cases has been dropping, and that is relieving some of the pressure on our hospitals. Public health professionals still have plenty of concerns, including the emergence of new variants, even as new treatments and booster vaccine shots are being considered for use. Rory Taylor reports on the game plan for state officials and healthcare providers in the coming months.
Oklahoma doctors are beginning to compare the late summer COVID surge to a fire that has finally burnt through most of its fuel.
With more and more immunity from high numbers of disease and from vaccination, hopefully we won't quite see that dry kindling that the virus needs to be able to propagate.
This week, cases in Oklahoma were 41% lower than the peak 7-day average case count when 2,806 cases were reported on August 30th. Additionally, hospitalizations have declined 33% since August 25th. This, of course, does not negate the fact that COVID-19 continues to put a strain on our hospital systems.
On Tuesday, epidemiologist Aaron Wendelboe, a member of the Healthier Oklahoma Coalition, shared this blunt message. Our state's COVID death toll could have been much lower.
So since that time, January 1st, there's been those 6,460 COVID-related deaths. Of those, 129 deaths, or 2%, have been among people who were fully vaccinated.
Nearly 6,500 Oklahomans have died since vaccines became available. That's more than half of the over 10,600 people who have died from COVID since the pandemic began.
The bottom line is, we could have prevented roughly 6,200 COVID-related deaths with more vaccines. That is approximately equal to the size of Pauls Valley or Anadarko. So as we move forward, it's just so important for us to realize that COVID can be prevented, particularly hospitalization and death.
While an additional third dose of the Pfizer and Moderna vaccines has been available to prompt an increased immune response in those immunocompromised, the FDA has now fully authorized a booster dose of the Pfizer vaccine, meant to reinvigorate a waned vaccine response.
The CDC recommends the following individuals receive a booster shot: people that are 65 years or over and residents in long-term care facilities should receive a booster shot. People aged 18 to 49 years with some underlying medical conditions should receive a booster shot. People aged 18 to 49 years with underlying medical conditions may receive a booster shot based on individual benefits and risks. People aged 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional settings may receive a booster shot, again, based on individual benefits and risks.
This news comes as doctors look forward to better treatments that are expected to become available in the near future.
So we've all heard about the new oral medication that is going to be up for review, molnupiravir. It is an antiviral medication. It has been investigated for hepatitis C and influenza.
Both Pfizer and Merck have entered trials for antiviral drugs, with Merck's drug molnupiravir also being studied by the FDA. Currently, all data on the effectiveness of these new therapeutics comes from the drug's manufacturers.
When we're really talking about a virus like this that is going to be with us in the likely future, the real goal is going to have to be something that doctors, primary doctors, urgent cares, hospitals can do easily on an outpatient basis, and in this case with an oral medication.
These new drugs are already being produced, so they'll be ready on a mass scale when they receive official approval from the FDA. However, doctors warn that in order to be effective, patients will need to be willing to get tested more often, because the therapeutics are only effective if the virus is discovered early.
People are positive with Delta, they feel fine for 5, 10, 15 days, and all of a sudden they crash and end up in the hospital, and at that point, that would be not useful. And for right now, those medicines, if you do end up in the hospital, those are not being requested for hospital treatment.
Dr. Clark also says that at least 10 non-injectable COVID vaccines, meaning oral or nasal spray vaccines, are currently in development. But health officials continue to urge the public to get vaccinated now and not wait until winter.
we need to continue to push for vaccination to make sure that we get that herd immunity nice and high so that when people do gather around the fireplace, there's going to be a lower risk of transmission. We certainly saw a winter surge last year, and until we see differently, we have to prepare for that possibility.
Rory Taylor, the Oklahoma News Report.
Rory, thank you. Now, as you can see, as of Friday morning, another dramatic decrease in our rolling 7-day average of new cases, a drop of 467 per day. We're getting close to seeing that number slip below 1,000. That's real progress. And for the first time since August 10th, total hospitalizations have dipped below 1,000, now down to 881 with 268 people occupying ICU beds. In the last 7 days, 284 people have died as a result of COVID. We recorded 307 deaths over the same period last week. And we are getting closer to 2 million Oklahomans fully vaccinated, representing 47.5% of our population.